Is eating meat and saturated fat actually the worst thing you can do for your heart health, or the opposite? Stay tuned to today's episode to find out more. Welcome back, my friends. My name is Sarah. I am known as Carnivore Yogi. Thank you so much for being here and clicking on today's video. Today, I have an interview with Philip Ovadia, Dr. Philip Ovadia, who is a carnivore heart surgeon. He has lost over 100 pounds himself on a carnivore diet and has a new book out called Stay Off My Operating Table. His new mission in life is to help people avoid cardiac heart surgery. And so he's written this extensive book, which I will link in the information section below for you guys, to help you at home assess your own metabolic health and look out for signs that could be leading you towards heart disease. So I hope that you guys find this information very helpful and applicable in your own life. Again, there will be timestamps in the information section, as well as a metabolic health quiz that Dr. Ovadia has set up that you can take today. That link will be in the information section for you guys. So I do hope that you enjoy today's episode, enjoy this interview. I want to thank briefly the sponsors of today's episode. The first one is going to be Upgraded Formulas. You know, I'm a huge fan of their magnesium. And speaking of the heart, if you have heart palpitations, this could be a sign of a mineral imbalance. And finding out what minerals are actually out of balance is going to be best done by a hair tissue mineral analysis, which Upgraded Formulas offers on their website. You can use my code YOGI12 to save on that hair tissue mineral analysis. And I also recommend getting a consultation because they will tell you exactly how much of each mineral that you need or don't need. You might be over supplementing, which is a huge thing I see a lot in my clients and can also lead to similar issues. So thank you to Upgraded Formulas for being a sponsor of today's show and making things like timestamps available to my audience. The second sponsor of today's show is Optimal Carnivore. You can use my code Carnivore uppercase Y to save on their organ meat complex as well as their grass-fed beef liver supplement. These are staples in my home. We take both this one and the beef liver supplement daily. I think they are amazing for keeping your immune system running robustly in the winter. Again, my code Carnivore Y, the link will all be down in the show notes. I hope that you guys enjoy today's episode with Dr. Ovadia. Please do leave us a comment, like this video, and please do share it out to anyone who you feel could be helped. We need to keep spreading this information about how we can heal ourselves without going down the allopathic medicine route. So please do enjoy the show, and I will talk with you guys again soon. Have a great day. All right, guys, thank you so much for coming back and tuning into the show. Today, I have a really special guest with me who has a personal story of transformation and is a cardiologist. Dr. Philip, thank you for being here. Welcome to the show.
Thank you, Sarah. As you mentioned, I'm actually a cardiac surgeon, a heart surgeon, and I have a personal, story that goes along with that I'm excited to get into with you.
Yeah, so it's been how many years now since you have lost 100 pounds?
It's been about 5 years since I started that journey and, lost, over 100 pounds and have maintained it. And more importantly, I think I came to realize, through that journey, the importance of metabolic health to our overall health and to the patients that I deal with every day with heart disease, as well as most of the other chronic medical problems that plague our society today.
Yeah, as a heart surgeon, you're definitely in the thick of it when it comes to people that are literally dying because of what is on their fork, would you say?
Yes, I, largely recognize that to be true now. And, unfortunately for the, first 10 years or so of my career, that was something that wasn't very apparent to me. And it's something that the healthcare system, the medical system, doesn't really do a very good job of recognizing. But what I realize now is that, the vast majority of the patients that I end up operating on are there because of their diet and their lifestyle. And therefore, that gives us a great opportunity to be able to prevent the need for heart surgery in many of these cases. And so that's sort of my new professional focus, my new mission. While I continue to do heart surgery, I would like as many people as possible to know that there is a way to greatly reduce their chances of ever needing heart surgery in the first place.
Yeah, I think that's a really important message to put out there. And, I get caught up in my health bubble and talking to so many different wellness professionals and people who are in the health optimization bubble, and I forget when I talk to everyday people out there that a lot of people are still eating Doritos and drinking Coke and just thinking that these things are just normal and okay. And so I feel like a message like yours, we should get it out to the masses, because it's rare that you have a surgeon, someone that's what you do for your livelihood, that you don't want you don't want more patients to end up in that situation, correct?
Yeah, exactly. And my new book, which just came out, it's called Stay Off My Operating Table. And, that's exactly what I'm looking to help people to do, to learn how to stay off my operating table.
Awesome. Well, let's back up a little bit and talk about your story. Why do you think there was it took a while for you to realize that you were going to be in danger of ending up on the table? What was that journey like for you?
Yeah, so, I had been overweight and obese my entire life, going back to childhood. And that was despite the fact that I grew up in a household that largely followed, the mainstream advice, the US dietary guidelines. I have an older brother who is a type 1 diabetic. So, we didn't have sugar in the house. We ate our, heart healthy whole grain cereals. We had low fat milk and margarine instead of butter, and, really all of those things that we were told were going to keep us healthy. And I was also very active as a child. I played sports years round, I rode my bike everywhere. And so all of these things that we were told should make us healthy. And yet I found myself getting more and more overweight, more and more obese as I grew older. And then, of course, I got into the, stressful college and medical school and training to become a heart surgeon, with a lot of long hours and poor sleep and eating in the hospital a lot of the times. And, just was becoming more and more unhealthy. And there were a few times that I kind of recognized this and realized I had to do something about it. And so I, did what I was taught to do and what I was taught to tell my patients to do: eat less, move more, count my calories, eat a low fat diet. And I would have some short term success. I lost probably 50 pounds, probably 3 different times,
Mm-hmm.
but always would gain it back, and usually more, which is an experience that I'm sure many in the audience can relate to. And about, 5 or 6 years ago, I really found myself as at a loss, because by that time I was morbidly obese, I was pre-diabetic, and I did realize that, I was going to end up on my own operating table, so to speak. And thankfully, at that point, I was able to come across some different ideas about why we get obese, why we get unhealthy. I was fortunate to hear Gary Taubes talk at a medical meeting. He had just written, The Case Against Sugar. And, what he talked about, that the types of food we eat are more important than the amount of food that we eat,
Mm.
you know, made a lot of sense to me. And I went and I read his books, and I started, looking into it more. And I adopted, a low carb, kind of low sugar uh, way of eating. And I had immediate success with it. And, over the next few years, that kind of evolved through keto and ultimately to, mostly carnivore diet that I've now maintained for coming up on 3 years. And like I said, it was great that I was able to do this for myself, but more importantly, it opened my eyes to what I needed to do to really help my patients, and to help people understand that, metabolic health and the types of food that we're eating are the most important determinant of our health. And that should be our primary focus when we are trying to keep people healthy, instead of just treating the diseases that they end up getting from their poor diets.
I agree. And you have, I guess, 5 different ways that you help people measure their metabolic health. Is that correct?
Correct. Yeah. And, if people want to go to Ovadia Heart Health, so that's OVADIA hearthealth.com/yogi. I've actually set up a metabolic health quiz that will take people through these 5 measures. But the 5 basic measures that we look at to determine if someone is metabolically healthy or not are your waist circumference. So very easy, measure it at home. You take a tape measure just above the level of your belly button. Best to measure it first thing in the morning. And if you are a woman, your goal is for that to be less than 35 inches. If you are a man, you want it to be less than 40 inches.
Got
The,
it.
the next measurement is your blood pressure. Again, you can check it at home. You can go to any grocery or pharmacy these days and put your arm in the little cuff. Or, when you go to your doctor, they're always going to check this. And the goal is for your blood pressure to be less than 130/85, and that should be without the use of medications. If you've been diagnosed with high blood pressure, if you've been started on medicine to lower your blood pressure, that's already a sign that you are not metabolically healthy.
Got it.
The final 3 metrics we look at are based on your blood work. Again, very basic blood work, your fasting blood glucose level. And so this is the amount of sugar in your blood when you haven't eaten for 8 to 12 hours, and you want that to be less than 100. This is milligrams per deciliter, the United States units. And again, that needs to be without the use of medication. Type 2 diabetes, having an elevated blood glucose level is, another hallmark of poor metabolic health. And finally, we look at the cholesterol panel. But interestingly, we don't look at the one cholesterol number that most doctors focus so much on. The LDL cholesterol, the so-called bad cholesterol, is not a marker of metabolic health. The other 2 numbers that are commonly on your cholesterol panel are, so you have your HDL cholesterol, what's, oftentimes called your good cholesterol. And as the nickname implies, you want more of this. The higher, the better. Specifically, if you're a man, you want this to be over 40. If you're a woman, you want it to be over 50. And the
All right.
final number we look at are your triglycerides, and you want that to be less than 150. And those are the 5 measures of metabolic health. Those are the basics. But what we know is that if you have 3 or more of those that are not within the healthy range, it actually diagnoses you with what we call metabolic syndrome. It's a medical diagnosis, and what it means is that you are at very high risk of developing things like heart disease, Alzheimer's disease, many forms of cancer have all been associated with the metabolic syndrome. And if you
Wow.
have 1 or 2 of those abnormal, it's a warning sign, because we know that people are, that have 1 or 2 abnormal today are likely to have 3 or more abnormal and be diagnosed with metabolic syndrome within the next few years. So, my what I tell people is that those 5 measures should be sort of your basic measuring stick. And these are things that, first of all, everyone needs to know these numbers, needs to know where they stand in regards to these numbers. And if they're not where you want them to be, if you're not in the healthy range on these numbers, you need to be actively working on that.
I agree. And obviously we talk about diet as a wonderful way to help work on these markers. What kind of a, I guess, regimen do you do yourself, and do you advise patients on if they do have, let's say, 2 of these markers?
Yeah, so, as I said, the first step is realizing that you have the issue and committing to do something about it. And unfortunately for a lot of people, that first step never occurs.
Hmm.
Their physicians aren't focused on this, and they're not focused on it, so they don't take that first step. Once you commit to improving your metabolic health, in the book I outlined 7 basic principles that are going to help you with that. And in terms of the way of eating, the dietary strategy, my big rule is to eat whole real food. So we want to eliminate the processed foods. As part of that, we want to eliminate the highly processed grains and the artificial, fake fats that get used in these processed foods. The vegetable and the seed oils are the 2 primary things within our food supply that lead to the majority of us being metabolically unhealthy. Now, within the whole real food, there's some room to figure out what works best for you, what you like, what's available to you. There's obviously, all of the animal products, meat, seafood, dairy, eggs, and then there are the, plants, the vegetables and the fruits. And, what I go through in the book is that there is no one right answer. I talk about both the carnivore and the vegan diets and a lot of things in between, things like keto and Mediterranean and paleo, and what is metabolically healthy about each one of those and what may not be, metabolically healthy about each one of them. And I think, each person needs to sort of find what works best for them.
I agree. And I heard you say on another interview, you do work with people who are vegetarian and vegan. How, because I've seen so many people that are on those diets. And when I personally was on that type of a diet, I was eating a ton of carbohydrates, a lot of sugars, a lot of fruits. So
Yep.
how do you work with somebody who's committed to that sort of a lifestyle?
Yeah, that's exactly it. Within the vegetarian and vegan framework, there's still a pretty wide variety. You can be eating a lot of processed food with all
Hmm.
of these vegetable and seed oils, these fake processed oils that damage our metabolism. And, you're not going to have success ultimately. What oftentimes happen is it's better than the standard American diet, so you get some short-term improvement when you do that. But over the long run, you still just need to eat whole real food. So the challenge for vegans and vegetarians is constructing that sort of plant-based diet, I think is a better term, that is whole real food. And you have to be able to get adequate protein sources, and you have to realize that there are some vitamins and minerals that are more challenging to get. But it can be done, and I do know people who are very successful doing that. Personally, it didn't work well for me either. And
Yeah.
as I mentioned, I've ended up on a basically, carnivore diet now for the past 3 years, a carnivore way of eating, and that's what works best for me. That's what I feel best doing, and the convenience and everything else that goes along with it. But like I said, it's not the only way. And as I talk about in the book, and I work with my, the clients that I work with directly on, I don't tell them all that they need to, do the same things that I do.
I like that. It's, I've worked with and talked to quite a few different doctors in the space that are carnivore themselves, yet they are willing to help people who are vegan and vegetarian, and they don't want to take this dogmatic approach of saying, no, you can't do that. You're going to have to let go of those religious beliefs or whatever beliefs that you have so that, you can heal yourself. So I really do appreciate that non-dogmatic approach for sure. Yeah. I wanted to ask you how your colleagues, or if your colleagues knew about your carnivore diet, and if so, what is their opinion? Did they freak out about it, or what's been the consensus?
Yeah, it certainly met with a lot of skepticism, amongst most of my colleagues. I am, happy to see that more and more, the sort of, I would say low carb, keto, that's sort of getting to be better accepted. Although, as we all know, there's still a lot of challenges, to that, and it's certainly not, anywhere near mainstream. The main concern that obviously comes up, for me with my, closest colleagues, being in the heart surgery world, is, the whole cholesterol issue.
Mm-hmm.
And, of course, discuss with them, what the data around cholesterol really shows us, and, where the gaps are in that data. And, the reality is that we do not have any evidence that having an elevated LDL cholesterol and elevated bad cholesterol in the setting of good metabolic health, so a high HDL cholesterol, low triglycerides, low insulin levels, and low inflammation, uh, there's no evidence that I have seen or that anyone's been able to show me that that is a concerning situation.
Mm.
I fully admit we don't know that it's safe, but we also don't know that it's, damaging in the same way that having the high LDL in the setting of poor metabolic health is. I have, I certainly, with my patients and, me personally, go well beyond just looking at a basic cholesterol panel and an LDL level. There's a lot of advanced, lipid testing that can be done to help, determine risk. Things like a coronary artery calcium scan, which I use, very frequently with my patients, and I've had done personally. And so again, for me personally, even though I have what's considered a high LDL cholesterol level, I know that my coronary artery calcium score is 0, and I have no evidence of heart disease. And again, I haven't seen any evidence to suggest that, what I'm doing is putting me at risk personally. But I have that discussion with all my patients. Again, similar to what we talked about, along the dietary issue. Um, my job is not to tell patients what they should do. I'm not here to tell them eat this, don't eat this, or take this medication, don't take this medication. I'm there to help them understand, their situation and the risk around that situation, and help them figure out what the best way for them, to manage their risk and their lifestyle and all that is going to be. And sometimes the right answer is, take the medications, and sometimes it's not the right answer to take the medications. But I think doctors, physicians, healthcare professionals of all, sorts need to do a better job at discussing that with patients.
I agree. And in what type of situations would you say that medication is warranted?
Well, certainly if someone, has these risk factors like an elevated cholesterol level, like poor metabolic health, like inflammation, that we can measure in the body, and they're not willing to make the changes, from a dietary and lifestyle standpoint that are going to help lower that risk, then I think, taking medications to try and lower that risk makes sense. I don't think it's as effective as the lifestyle interventions are ultimately, but if the person is just not willing to change, the medications probably have some effect at lowering that risk. So again, that's the choice that the patient should be able to make. But unfortunately, most patients aren't even told they have that choice. When most patients go to their physicians and their healthcare professionals, and they're told that they have, high blood pressure, let's say, or type 2 diabetes, they're told that the only option is to take medications to try and control that problem. They're usually not even told that they have the option of changing, the way they eat, changing their lifestyle, and that these conditions can be reversed.
Wow. Yeah, I agree that I can't even tell you how many people I know, again, not in my bubble, my health bubble, that they don't understand. They don't know that type 2 diabetes is a reversible condition. And that is not common knowledge. People think
No,
that once you get it, you've got it for life. And that shocks me that people still don't know you can reverse that.
yeah, exactly. And, even among physicians and healthcare professionals, most of the physicians I interact with don't realize that either.
Really?
Despite the fact that, Verda Health published their data, Now I think it's over a year ago that they published their data, but they looked at their 2 year data, their 2 year experience with patients, and they were able to show that 60% of the patients, reversed their type 2 diabetes, got off medications, and had normal, glucose levels. And most physicians, I would even say most, endocrinologists who specialize in the treatment of diabetes don't realize that reversal of type 2 diabetes is a very real option. It's a very, real outcome that can be accomplished with the proper, dietary and lifestyle interventions.
Yeah, absolutely. That's again, we need to get this message out there because we all get stuck in our bubble of, keto, carnivore, and low carb. I know a lot of my listeners, we've all been kind of around for the last few years, and we forget that most people just have no idea that they're not doomed. And I grew up as an overweight person myself and have lost 100 pounds three times.
Yep.
So I'm very familiar with the gaining and losing and the cycle that we all get into with our health. And so yeah, I think it's important that we keep shouting this message for sure.
Yeah, we've unfortunately gotten to a place where so many people are unhealthy that we
Mhm.
don't even realize that it's abnormal anymore. It's
Yes.
so common that we fail to see that it's abnormal. The statistics
Yeah.
show that 88% of the adults in the United States are not metabolically healthy. So those five measures that I talked about a little earlier, only 12% of the adults in the United States can meet all five measures of metabolic health. And we also know that by the time you're 50 years old, in the United States, there's a 60% chance that you are going to be on multiple medications, not just on one medication, on multiple medications by the time you're 50 years old. So, when most people look all around them and everyone around them is unhealthy, they don't even realize that it's possible to be healthy anymore.
Yeah.
And our healthcare system, unfortunately, basically reinforces that message because the healthcare system has evolved to a place that it's so focused on taking care of unhealthy people that it doesn't, get the message out that it's possible to be healthy anymore.
Yeah, that I mean, our medical system, unfortunately, allopathic medicine is not about prevention. It's about like, okay, you've got this horrible problem. Now let's operate, let's fix it, let's save your life. But the problem with our system, I feel like, is that we're not telling people what steps they can take to prevent these types of situations. So, what would you say your biggest pieces of advice to someone who wants to prevent, again, heart surgery ending up on your table? What are the biggest pieces of advice that you give people to prevent those things from happening?
Yeah, so it's clear that the biggest risk factor for heart disease is poor metabolic health.
Mm.
We look at the studies, and as much as we talk about, cholesterol, specifically LDL cholesterol being a risk factor, when you look at the large studies that are done, most recently there was the Women's Health Initiative has been an ongoing study, and they went back and they looked at the risk factors in those participants for heart disease. And, what they found was having an elevated LDL cholesterol level puts you at about a 1.4x, risk of not having an elevated LDL cholesterol level in terms of heart disease. But
Wow.
what they found is that being insulin resistant, which is a synonymous with poor metabolic health, puts you at a 6x risk of heart disease. So, whether or not we want to accept that cholesterol in and of itself is a true risk factor for heart disease. It's clear that the poor metabolic health is a much bigger risk factor for heart disease. The only thing that came out as a bigger risk factor than poor metabolic health in that study was smoking.
Wow.
So um, that tells me that if you want to, have the best chance of lowering your risk of heart disease, you should focus on being metabolically healthy. And
Hmm.
as I said, in my book, I outlined 7 principles that are going to, be the framework for people to get metabolically healthy. One of them we talked about already, eat whole real food. The first principle, I think, is a very important principle that I talk about in the book, and that's that you need to think of your health as a system, not a goal.
Mm,
That's sort of the mindset issue that we can't be focused on short-term goals, things like losing weight, losing 20 pounds.
yeah.
Because when we focus on the short-term goal, what happened, one of two things is going to happen. Either you're going to meet that goal and you're going to say, great, I did what I needed to do. Now I can kind of go back to what I was doing before. Or you're not going to meet that goal and you're going to kind of get discouraged and, you end up giving up and just going back to what you were doing before. So instead, what I try to get people to do is to change their mindset, to think of their health as a system. And you want to say, I want to be metabolically healthy, and I need to find the system, the habits that are going to allow me to get there. And, that gets into some of the other principles about what we eat, getting enough sleep, managing your stress, an appropriate amount of activity throughout your day, and finding a partner, a healthcare practitioner to work with that understands this as well. And those are probably, those are the basic principles that I outline and that I think everyone should be using to help improve your metabolic health and get you to where you want to be.
Definitely. And what are your views on exercise? Do you think people need to be doing a lot of cardio? Do they need to be doing more strength training, and how often?
Yeah, so what I talk about in the book, the principle that I put out around activity is I say move more. I don't
Hmm.
really say exercise. And, there are a couple of components to that. I think when we look at all the data around, aging and metabolic health and avoiding chronic disease, it's clear that the more that you are able to maintain muscle as you age, the better the outcomes are. And so I, you know, tell people that their priority as they're kind of thinking about their activities, their exercises, should be to build and maintain muscle mass. And I think the best way to do that is with resistance exercise. That can be body weight exercises, that can be, lifting weights, that can be using like a resistance band system that they have these days. Anything that you can do to help you build and maintain muscle, I think is your first priority. And then I tell people you just need to move more throughout your day. Going to the gym for an hour a day and doing, some sort of cardio, whether it's running on the treadmill or being on the elliptical bike or even, being outside riding your bike or running. If you do that for, an hour a day, but then you spend the rest of your
Yeah.
day sitting at your desk and not moving,
Yeah.
I don't think that's going to be any net benefit. And the studies show that it's not any net benefit.
Mm-mm.
So I'd rather that people figure out ways to just incorporate more movement throughout their day than, having that dedicated exercise time. So, these are simple things like taking the stairs instead of the elevator when you can, taking, that 10 to 15-minute walk after you eat, or, taking breaks throughout your day to get up and walk around. These, little things, I think, end up having a bigger impact than if you just, spend the time at the gym or doing your cardio.
I agree.
Ultimately, if you have the time to do the cardio, great. It's just that the reality is that most of us time is our most precious resource. And so if I'm going to dedicate time, specifically for exercise, I think it's better spent on resistance exercise than cardio.
I agree. I mean, I just try to move as much as I can. I'm like, if I could fold this laundry standing up, I'll stand up. I just try to think of more ways that I can stand up and just be doing things rather than sitting. And I think resistance training is far more important, especially, I'm 42. So it's like once you get past 35, a whole bunch of stuff starts happening where you're like, all right, we've got to maintain muscle. And I feel like muscle should be a currency that we really focus on as we age, because the biggest thing I hear when people are old is that they fall and they can't recover from falling, and that's terrifying to me.
Yeah, that's a big aspect of it. And the other big aspect of it is that muscle is the most metabolically healthy, most metabolically active tissue that we have. So, the more muscle that you have and the more muscle that you maintain as you age, the easier it's going to be to remain metabolically healthy.
Agree.
So that is the other, big reason that I prioritize, building and maintaining muscle when I'm working, with people and for myself as well.
Definitely. I'm curious to know your thoughts on fasting, time restricted eating, or if you think people should limit their amount of meals they eat per day. What are your thoughts on all of that?
Yeah, so I think time restricted eating and fasting are great tools. What, perhaps my view on it that's a little different than most is that I don't think it should be something that's kind of forced.
Hmm.
Ultimately, I tell people, find a way to eat that makes you less hungry so that you're going to, end up eating less often. So the types of foods that you're eating, are going to influence how quickly you become hungry again. And this is where, prioritizing, whole real food, high protein foods comes into play. So, I think, fasting is a great tool. Again, me personally, I end up eating once or twice a day most days. But I don't do that because I'm forcing myself to only eat once or twice a day. I do that because I'm only hungry once or twice a
Hmm.
day. And I think that is a more sustainable way to, kind of go about that than just, setting that rigid, I'm only going to eat once or twice a day, even if I am, hungry.
Yeah, I find that the longer that I do this, low carb lifestyle is what I like to look at it now, instead of putting it a specific label on it, really just low carb lifestyle. That, I have some days where I'm finished eating by noon. I have some days, I'll eat the breakfast, eat noon, and then done till the next day. And then I'll have some days where, I'm eating 3 meals that day. So I don't like to have people say, oh, you can only eat 1 meal a day or you have to stick to a regimen. I think long term health is something that's maintainable and sustainable. And we don't have the same needs every single day. Some days you're a lot more active than other days, and you might need to have 2 meals instead of just the one.
Exactly. And, again, as people who are overweight and need to lose weight, as they lose the weight, as they get less body fat and less stores, it may become harder for them to fast, and it might be easy in the beginning because once your body is able to tap into that stored energy, um, you have plenty of stored energy to draw upon, and it usually is easier to fast. And then what I typically find is as people are losing the weight and kind of burning through their fat stores, then it might become a little bit more difficult again, and you might need to adjust some things that you're doing to get your body to that sustainable place where you can just learn to eat when you're hungry and then stop eating when you're full and let your body, really be the guide there.
Yeah, that's definitely a tough one for people. I mean, I think that's what a lot of people hear when they come to this type of lifestyle is just, eat when you're hungry and stop when you're full. But someone like me, I've lost 100 pounds 3 separate times in my life. It took me a long time to really get to that place to understand what hunger actually feels like. And it's not, and I'm not eating for emotional reasons or because I'm tired. And so I feel like there's definitely some coaching and some counseling people may need along the journey if they're still trying to do this and they're like I feel like I don't know when I'm hungry. Did you struggle with that at all along your journey?
Yes, definitely. And, where I am now, is certainly a much different place than I was at the beginning of the journey and even, in the middle of the journey.
Hmm.
And, that's an important concept that people, should understand as well. Because just as I said earlier, there's not one right diet that works for everyone. There's also not one right diet that is necessarily going to be the one diet that you're on for the rest of your life, or the one way of eating that you're on for the rest of your life.
Definitely. And you mentioned, I know one of your things that you have people do is stress management. What are your favorite ways to manage stress for yourself, and what do you advise your patients to do?
Yeah, so I again, go through many options with my patients, and I think there are many different ways to do this. For some people, it's kind of meditation, and real sort of what I call active relaxation. For other people, it might be religion, or just family time. It's one of the things that sometimes gets a little bit wrong in the messaging that we hear is that we need to avoid stress. And the
Mm-hmm.
reality is that we can't avoid stress. We live in a stressful world. Most of us have stressful lives. We can't just go off to the island somewhere and sit by ourselves and not be stressed. It's more a manage of managing stress and not letting that stress be a constant factor in your life. So, what I tell people is that you just need to find something, some outlet that's going to allow you to basically deal with that stress and sort of compensate for it. And that can be, like I said, many different things. It can be meditation, it can be religion, it can be family, it can be, sitting in the sauna. For some people, it is exercise. The cardio exercise, sort of serves as their stress relief. And so, I think that that can be a potential benefit. But just in the end, everyone needs to find some way that's going to allow them to be less, to deal better with the stress. Because it is clear that stress in and of itself, can lead to inflammation, can contribute to poor metabolic health because of the hormonal changes that stress induces. So I think it is a very important component to all of this.
Definitely. And, if there's someone who's listening who is currently seeing a doctor for heart health, and maybe they're on a lot of medications that they don't necessarily want to be on, how would you advise them? Like, what lifestyle changes would you advise them to make to kind of transition off medications? Or do you think that they just need to stay on their medications long term? What are your thoughts on that?
Yeah, so, I think when you look at all of these things we talked about, all of the, kind of the principles that I go through in the book, what we eat is clearly the most important one. And I think really, most people can get most of the improvement that they need to get just by focusing on what they are eating and the types of food that they are eating, and eating the whole real foods. So I that is usually going to be the first thing that people need to be focused on, and people need to be willing to change. Like I said, if you're not going to change that, if you're not willing to change that, then staying on the medications might be your best option.
Mm.
But first and foremost, what I work when patients come to me, I do have a private telemedicine practice that I work with people one on one through, on doing these lifestyle, improvements and improving their metabolic health. And the diet is always the first thing that we talk about.
Awesome. Yeah, I think that's the great place to start. It's like the low hanging fruit, so to speak. That's where the biggest changes need to happen for sure.
Yeah, and oftentimes what I find is when people, start changing that, it then leads to the other changes occurring. Because once they, start feeling better, once they start feeling the effects of eating better, then they're more motivated to exercise. They want to deal with their stress, or a lot of the stress that we perceive is actually coming from, what we're eating. When your
Hmm.
blood sugar levels are constantly going up and down, your body perceives that as stress. So when you can reverse that problem and improve what you're eating, and get more stable blood sugar levels, for instance, that in and of itself helps a lot of people to be, less stressed, and then they sleep better, and they're motivated to exercise. They want to exercise. They want to move more. These are all things that I find come from eating better first, as opposed to trying to do all the other stuff while you're still, not eating well.
Absolutely. And you mentioned sleep quite a bit. I feel like that is a big topic that a lot of people really struggle with is poor sleep. So what are your top tips to help people really get control of their sleep?
Yeah. So, again, the first thing I find is when people eat better, they sleep better. And, when you're not having the sort of sugar roller coaster ride that most people who are on a typical, kind of standard American diet go through all night, that in and of itself is going to lead to better sleep. And then, there are the sleep, kind of hygiene habits that I talk about as well. So, not consuming alcohol too close to when you're going to go to sleep. Um, Making sure that you have a good sleep environment, that's quiet enough and dark enough. And sometimes, that involves using, kind of some tools like a sleep mask, or even, perhaps, some sort of noise cancellation, device or earphones that they have. These are all things that can support good sleep. And I also think that the light, sort of light hygiene,
Hmm.
not staring at screens right before you're trying to go to sleep, is important as well. And that becomes a big factor for many of us.
Definitely. That's my big focus right now is the light hygiene. I think that's an overlooked piece for a lot of people because, and that we talk about stress as well. If you're on your screen all the time, you're never allowing your body and your mind to truly rest. You're hyper vigilant, or you're getting all these dopamine hits, and you're not really giving your body that time to rest and recover, I think.
Yeah, I think that's a big issue for many people.
Yeah, definitely. Well, this has been really, really amazing. And I want to lead people to where they can find you, where they can work with you. You mentioned you do some telemedicine. Are you taking patients currently right now?
Yes. So,
Okay.
as I mentioned before, if you go to ovadiahearthealth.com/yogi, you'll take the metabolic health quiz. At the end of that quiz, you'll have the opportunity to book a discovery call with me to see if, joining my practice would be a good option for you. And it will also, lead you to the book itself. Again, it's called Stay Off My Operating Table. It's available on Amazon as well as all the other major online sellers. It is available in audiobook, Kindle, and both hardcover and paperback versions. So that has all the principles, all the basic information that people need to start implementing these changes for themselves and start understanding why they need to implement these changes. And then, through my telemedicine practice, Ovadia Heart Health, I work with people one on one that are interested in doing that deeper dive.
Awesome. Well, I'll make sure I link all that information below so people can find you and work with you, and definitely check out your book. I think there's a host of wonderful information in there. So thank you so much, Dr. Phillip, for coming and chatting with me today. I appreciate it.
Thank you, Sarah.
Yeah.